Good evening and welcome to Doctors on Call. If you've been struggling with varicose veins, leg cramps, peripheral artery disease, or any kind of circulation and leg problems, now is the time to get your questions ready and call them in. I'm Dr. Ray Christensen from the Department of Family Medicine and Community Health at the University of Minnesota Medical School here in Duluth, and I'm your host tonight. We're ready to take your questions about circulation and leg problems. Give us a call locally at 218-788-2844 or toll free at 1-877-307-8762. Here to answer your questions are this evening's panelists. Dr. Mark Eginton, a vascular surgeon with St. Luke's Pavilion Surgical Associates. Dr. Emily Onello, a family physician with Lake Superior Community Health Center in Duluth and a faculty member at the medical school in Duluth. And Dr. Gregory Snyder, an interventional radiologist with St. Mary's Medical Center. Medical students answering the phones tonight are Carrie Bergstrahl from Mazeppa, Minnesota, Brent Schodel of Sauk Rapids, Minnesota, and Cammie Young from Vernon Center, Minnesota. And now on to tonight's program on circulation and leg problems. We have a really interesting panel tonight because we'll have the opportunity to hear from the family physicians as well as a vascular surgeon and an interventional radiologist. And I think to start out, Dr. Onello, I always like to pick on the family doc first, but we really are looking at two different things, the vascular system, the venous and the arterial. Do you want to talk about varicose veins, peripheral artery disease just a little bit to ramp us up?
I think that's, I appreciate that question because I think people can get confused when we talk about veins and arteries, but essentially the way I like to think of it is that problems that can be attributed to arteries not working are generally large vessels that are bringing blood to your legs and lower limb, whereas the veins are sort of the mellower version that are just bringing fluids and waste products back out of your lower extremities. And so the problems that ensue when either one of those types of vessels isn't working differ greatly, and the symptoms are quite different. Even though I think most folks think of them as fairly similar as pipes, in actuality the symptoms and the types of problems that arise when they don't work well are very different. For example, when people get a lot of leg swelling and puffiness, that can be caused by a variety of problems, but typically not necessarily a sign that your arteries are not working or delivering blood to the legs. Often I think more other types of problems, including veins that may not be carrying, as I mentioned, fluid back up towards the heart.
Dr. Eginton, you're a vascular surgeon. Could you tell us a little bit about the type of work you do, patients that you see?
It's a pretty big.
I know it's large.
It's a pretty big breadth of our practice, but in a nutshell, we kind of deal with blood vessels, in their entirety, and a holistic, if you will, approach to care of the patient. I mean, as a vascular surgeon, it's a bit of a misnomer because the majority of the patients that I see and treat, I actually don't end up operating on as a vascular surgeon. A lot of them I treat from a medical or a lifestyle, modification standpoint. But as far as surgeries go, I do perform procedures on veins, varicose veins, venous insufficiency. Also, we treat, as a vascular surgeon, peripheral arterial disease for people that are having arterial, issues, as well as abdominal aneurysms, which is number 13 killer in the U.S., but number 13 doesn't get a lot of press, so most people don't even know they exist until they have a family member that gets involved. And then cerebrovascular disease or carotid disease as a source of stroke is another area that I would potentially operate on and treat.
Dr. Snyder, I think you're probably the newest to the medical community amongst us. You bring a skill that I'm not all that familiar with. I know that it exists, but that's where it kind of stops. Interventional radiology. You want to talk to us a little bit about that?
Yes, I'm a vascular and interventional radiologist. Essentially, my training is through radiology after medical school, which is the medical imaging specialty where you use ultrasound or CT to identify problems within the body. Interventional radiology is then a fellowship that goes on after that where you learn the surgical subspecialties to use these types of imaging modalities to do things to the body. So the biggest part of my day also involves working in arterial and venous systems, and that's where we share a lot in common with vascular surgery. The difference would be, or the commonalities would be that when we're doing the inside the artery and inside the vein work, using medical imaging to see things like real-time X-ray or ultrasound. That's definitely the training that we've had. And in fact, I'm fortunate enough that I was the director of the fellowship at the University of Minnesota up until this last May when I came to the community here. I wanted to build on something that you had said about arteries and veins, a very excellent description, I think. And I think the main thing to remember is that the mechanism of how arteries and veins, the flow is completely different. Arteries have the heart, which allows it to continuously push fluid forward. So the problems you get really revolve around plugging of the vessels, and that's where the cholesterol comes in, or calcification, and so the problems you get are the blood can't get through to the other side. The venous side is dependent on very small valves that open and close when the blood moves up and down, and that's why clots in the legs can be so detrimental. As the clot heals, it takes away that valve, and blood can no longer come upstream. The same exact true for varicose veins. You lose that top valve in the vein breaks down. So they're similar in pipes. I agree 100%, but I think your description was very important for people to know. There's a completely different mechanism, and we treat different ways depending on what's broken. So.
Yeah, and vein function, you know, it's not just varicose veins. I mean, you know, if a dysfunction of the venous system can be an absolute bane to a person's existence, you know, things, venous insufficiency, chronic swelling, ulcerations, the things that we see. So it's, you know, that's a pretty morbid problem as well.
So
Yeah.
go ahead.
I'm sorry, and I guess, you know, I know we had spoken before the show. Our main goal tonight was to bring as much education as we can, and really just encourage people who are having, you know, any types of symptoms, tiredness in the legs, achy legs, problems walking more than a block, or issues with wound healing, especially our diabetic population. Please talk to your primary care professional, wherever that is, and get into the system. With very simple exams, we can isolate what's going on, and we can oftentimes make life-changing treatments simply, easily, and oftentimes on an outpatient basis.
And it's not just aging.
It's not just aging, no.
That's
Not
good
at
to
all.
hear. Dr. Onello, someone did what really is nice to have happen. They called it a question earlier today. So it's okay to call in early questions. There's a viewer that would like to know if swelling around the ankles can be an indication of congestive heart failure.
That is a super question, and as I mentioned before, when you think as a healthcare provider of all the causes of swelling, the list is long. And so I certainly, as a preemptive response to that question, congestive heart failure or sort of poor flow throughout your circulatory system because the heart isn't pumping as well is certainly on the list of reasons, but there can be a large variety of other reasons. Problems with the vein right there in the leg. Many folks who are watching the show know that even late pregnancy can lead to some swelling in the legs as part of the physiologic change of pregnancy. So I try to steer patients away from immediate conclusions that might be frightening, to assume that just because you have swelling, it may be from the heart. Certainly problems with the kidney, problems with the liver, problems with the thyroid can also manifest themselves as some puffiness or swelling. So I would echo what you said earlier, that if you are experiencing new swelling or long-standing swelling, or certainly if you're experiencing asymmetric, one side larger than the other types of leg and ankle swelling, I would seek medical attention for that. So you can get an explanation which could include congestive heart failure, but may actually indicate something different.
Mark, thank you very much. Well done. Mark, earlier you alluded to physical non-interventional therapies. What are the things that can make leg problems worse? I'm thinking diabetes and smoking and other things. Are there things that people can do to avoid the problem in the first place?
You bet. I say this over and over again all day long. Basically, if you just don't smoke, those are the top 10 things on the list. Just don't smoke. And I mean, it is literally a night and day difference when I examine a patient, whether they've been a smoker or not, in the character of their arteries. Other things, the controlling cholesterol, sure, but other medications. There's all sorts of lotions, potions, but really the key thing is don't smoke, eat a decent diet, and exercise.
Dr. Onello, as a family doc, your thoughts?
Well, I'm delighted you mentioned exercise because I think even for smokers, if they can be active, that's certainly going to help counteract the damage of that. But certainly making sure that you don't have diabetes, and if you do have diabetes, controlling that well.
There was an article in the Star Trib, I believe, earlier, maybe it was last week, Dr. Snyder, I think it was from your old, our place and your place, University of Minnesota, regarding exercise and the treatment of peripheral vascular disease, peripheral artery disease. Any thoughts on that versus the kind of work that you guys do?
You know, definitely I think that prevention goes a long way toward keeping the diseases from developing. And again, on the arterial side, it's really a matter of exercising, which builds up the size of the arteries and builds up their capacity to move blood. So even if you start having cholesterol narrowing or plaque narrowing, you've redistributed or you've allowed the artery to increase in size to provide more of the flow. But there has been a fair amount of research that looks at exercise alone as a treatment for peripheral arterial disease. I'll tell you, in early stages that may be a good choice, but you know, as you and I both know, the patients that come to see us oftentimes will have acute on chronic problems. So they'll have a narrowing that they've lived with for a certain period of time, and then they'll develop a clot on top of it. And a big part of our job will be then to go into the vascular system, start by dissolving that clot, and then find the reason. And I just want to show these off. I brought some stents that we would use in that type of treatment. And I'll just hold this up so you can see it. And oftentimes we'll end up placing a small metal piece like this, which recreates the pipe and allows flow to reoccur. You know, on the arterial side, it's straightforward. It's a matter of getting the blood pressure down to the heart. It really revolves around getting the pressure. And this is why I would encourage patients or people who are having any types of symptoms. On the arterial side, it's quite easy. With a simple blood pressure test, taking blood pressures at your wrists and at your ankles and comparing those numbers, the ankle brachial index, we can tell so much about a person's health. So I would encourage people who are having any of these types of symptoms to go in for screening. To circle back to your initial question, yeah, exercise will always help people. Smoking is miserable. I concur 100%. I think that it's a terrible thing when people do smoke. Of course, we treat everybody. Smoking causes the artery to narrow, so if you're already dealing with an artery that's partially plugged, every time you smoke, it narrows more. But again, smokers are probably tired of the lecture. We're obligated to keep telling them, and we will treat people regardless of anything. But do yourself a favor, kids. Stop smoking.
Dr. Onello, there's a question or comment here. This person has severe cramping in his leg. And he's put on a couple of medicines and they haven't helped. So the question, because I haven't gone there yet, are there medications for this illness and for peripheral artery disease and medicines that work, or is everything coming back to you two gentlemen?
Well, that is a super question, because the term cramping, and I do see quite a bit of that in my practice, both lower extremity and sometimes upper extremity, warrants, again, I guess I'm on a theme tonight of further investigation, because the list of things that can cause cramping is hefty. And if we are assuming that the cramping that your caller is referring to is from the blockage of the artery, then certainly there are medications as well as interventions and procedures. But I would sort of roll back the question and try and ascertain what is causing the cramping. There are other conditions that can do that. Everything from imbalances of the chemicals in the blood and vitamin deficiencies and things like that, nerve problems. So the answer is vague but broad, and I would say to figure out what the pattern of cramping is and pursue treatment based on that.
So I can't dodge the question of restless legs because there are several questions coming in on restless legs. What causes restless legs? What can a person do for it? Thoughts, and please feel free to enter in, any one of you.
I'll say in my experience that when we started doing a lot of work with varicose, veins and with failure of the superficial venous system. The blood flow out of the leg comes from two primary sets of veins. The deep system, which moves about 90% of the blood in a normal person, and that's the system that's down around the bone and around and surrounded by muscle. You have the superficial system, which is the stuff up by the leg, and that moves about 10% of the blood. When that system breaks down, it's very common for that area where it's broken down to swell, and even that mild swelling will trigger the itch receptors and cause people to move their legs. If people have restless legs, a treatment as easy as compression stockings, or a trial to get a pair of compression stockings, put them on and see if that cures your restless leg issues. If that cures your restless leg issues, there's a very high likelihood that we can treat you in a way that will get rid of that so you don't need to wear the stockings for quality of life.
So a backup question to that, why shouldn't compression stockings be worn for 24 hours?
Well, it's a lifestyle choice. It's difficult to wear compression stockings for 24 hours a day. There are certain insurance providers who would like to see that all patients wear compression stockings instead of life-altering procedures, but that's a different show. And it is difficult to ask a human being to put on a pair of tight compression stockings and wear them nonstop to maintain a certain quality of life that can be easily fixed, again, in an outpatient environment with a simple procedure.
Although with veins, it's about physics. And you know, the inflammation that we were talking about in the veins that causes the pain and discomfort is due to the increased pressure. And it's kind of a chronic increased pressure in the vein. Well, when you're laying down in bed at night, your legs are at the level of your heart. So there's really no increased pressure. And so if you wear the support socks, they're graded compression socks. They are not TED socks, which are anti-embolism socks like you get when you're in the hospital for surgery. They're two completely different things and made for different purposes. But if you wear your compression socks when you're up during the day, you'll decrease that inflammation, and then at night you don't need them because your legs are at the level of your heart.
The other problem, of course, is getting them on.
Yeah.
Yes.
I think I'd just like to follow up on these excellent points. That for some people, we think restless leg syndrome may be unrelated to a vein problem, and they also can pursue some treatments that may sound, we don't fully understand it, but by sometimes replacing iron with iron supplementation for certain individuals seems to help, and certain medications that can affect the nervous system. We will prescribe for folks to take often at bedtime for that classic symptoms of restless leg where they have more of a discomfort and a need to sort of wiggle that alleviates some of that discomfort.
One of the Parkinson drugs also sometimes is helpful.
That's right. That's right.
What causes leg cramps?
That goes back to
Leg
her
cramps,
long
yeah.
answer.
Yeah. Yeah.
There are
many
many
things.
different things.
Yeah.
I guess
It's a good question.
In my world, there are a couple of things, and one is that a patient will come in, they're concerned because they have night cramps, muscular cramps, which is, I think, what we're talking about with the long answer. And then there's another issue where people have, pain in their leg or in their foot during the nighttime hours, and I look at those as two separate things. So the muscular cramps are probably muscular cramps, but if you have kind of a continuous crampy pain in your foot all night long, that's a different problem.
What do you do about that? Because there's some questions of
Yeah,
that
that
too.
is, and again, I don't want to get people unduly concerned because it's a vast minority of people that have pain and foot cramps, but in my world as a vascular surgeon and a specialist with blood vessels, I worry that there could potentially be enough lack of blood flow that the foot is not happy, it's not getting enough blood flow to survive. And usually those people will give you a story that at nighttime they hang their foot off the bed, and when they hang it off the bed it feels better for a little bit but not for long. Or they'll stand up and walk around on it a little bit and it feels better that way. And that's where we start worrying about needing to improve the blood flow to the foot.
Yeah, I would agree, and I think that the issue about the socks, baby powder, oftentimes if they put baby powder on the leg, it's a good strategy to try, so people are struggling with that, have had good success with that. Definitely folks who have pain at night and hang the feet off the end of the bed, I think that's a key issue, that gravity is helping, like you said, for short term bring the blood flow down. But by the time you're having that level of discomfort, there has to be a problem as well in some of the larger vessels upstream. And something as easy as an ultrasound can diagnose those. Or again, going back to the ankle brachial index, taking a basic blood pressure measurement of the ankles and the arms, and we'll know so much about just how the pressure is getting downstream. If there's no blood pressure getting to the foot, we know that there's a problem on the artery going down to that foot. And then it's our job to find it with ultrasound, and the treatment can be very straightforward. Balloon angioplasty to stretch it out of place, stenting, removal of plaque. But again, the whole leg pain issue, this is just a very small part of one of the issues.
And you can diagnose it even easier if you can feel pulses.
Yeah, or not.
Well, as
That's
Ben
not an
Owens,
issue.
Ben Owens
Yeah.
used to say, go see your family doc and get it checked
Lay
out.
your hand,
checked out,
Yep,
that's
put
right.
your hands in the patient and see.
Okay, for once and for all on tobacco, is chewing tobacco okay?
No.
Oh, come on,
No.
why not?
Tobacco releases certain chemicals within the bloodstream. Smoking tobacco releases them more quickly. Chewing tobacco releases them in a different mechanism, but more slowly, but releases the same types of things that cause the arteries to clamp down, which again leads to a problem with the plugged artery that's now shrinking. You reduce your blood flow even more significantly.
Tobacco in any form is bad.
Yeah. Not to mention, if you chew tobacco, you can end up without a jaw.
That's right.
Without a jaw.
That's right, and a tongue and a few other things.
An attractive look.
Since menopause, my feet have been cold all day, every day, with the exception when I'm in bed. Should I be worried?
I
That is-
hope not, because that's me too. Except for the menopause.
But
part.
I-
Yeah, except for the menopause part.
This is Duluth.
Yeah, I think, that's a good question. I would want, if this were my patient, I would want to know a little bit more about the colds, such as, are they visually discolored? Do they appear pale? There are some conditions where the blood vessels kind of tighten up more in the extremities. I would also want to know, as my colleagues here have mentioned, is there a pattern to the coldness? If they're exercising, do they get cramping in their calves? So I think it doesn't jump out at me as an alarming symptom by any means. Certainly if you're experiencing that, I would bring it up with your regular healthcare provider, your physician, or whomever you see.
There's a question about an over-the-counter drug by Highland for leg cramps. I don't know anything about such a drug, and I'm not aware of any use for it, but I put it out for you to.
Highland for leg cramps?
Well, it's made by Highland, and
Okay.
it's named leg cramps, I guess, something
Leg
to
cramps
that,
is the name of the drug?
something on that order.
I'm not familiar with that one.
I'm not either, but I think it raises a good point that there are quite a few over-the-counter and even herbal remedies. I've heard of ginkgo biloba for peripheral flow and all kinds of things. And I think really those types of questions really need to be individualized, because sometimes those things can interact. First of all, they often have multiple ingredients that it's not just one agent, and number two, they can interact with your prescription medications. So I'd bring the bottle in to your clinic or ask a pharmacist.
Will an overweight person have, excuse me, will an overweight person have more leg problems than a person of normal weight?
Yes, like so many issues that come with being overweight, it increases, it may not increase your propensity to initially develop varicose veins. There's some questionable data on that, but obesity definitely plays a role in wound healing, and increased weight will increase the pressure in the vessels. And unfortunately they tend to go hand in hand, so we have a lot of experience in the medical community with obesity.
And chiming in certainly with arthritis of the knee and other kind of weight-bearing issues on the joint wear and tear.
What can I do for my neuropathy?
Neuropathy.
It kind of falls to you.
Yeah. These are tough questions. Neuropathy is, for the viewers that suffer from it, a great challenge. There certainly are medication treatments. We don't, to my knowledge, have an easy cure. Certainly controlling whatever conditions may have led to the neuropathy, such as diabetes. If there is, in some rare cases, there can be a vitamin imbalance that can possibly improve as you treat the nutritional deficiency. But everything from pepper cream, such as capsaicin, has been used. Also, some nerve pain modulators like gabapentin and amitriptyline can often minimize the symptoms. So broad topic, lots of causes of neuropathy, very common, unfortunately.
And no good answer.
No
I mean,
good.
all the treatments are, moderate, benefit at best. They get some improvement and they're happy for that, but
Yeah,
it's
no cure.
a very partial.
30 seconds. What is the cause of lymphedema, and how do you treat it?
Lymphedema is a very difficult corner. There's a separate system, 30 seconds. There's a separate system that moves the fluid that moves white blood cells, and when that gets cut for one reason or another, you can get a lot of swelling. There's a number of techniques. Come in and see your doctor in 30 seconds. We can try to cure it, or at least try to manage it.
Compression garments, compression pumps, massage.
Massage.
PT's got some things
Yeah.
they can do.
The lymphedema massage can be very helpful.
I want to thank our
They need to be
panelists, Dr. Mark
evaluated.
Eginton, Dr. Emily Onello, and Dr. Gregory Snyder, and our medical student volunteers, Carrie Bergstrahl, Brent Schodel, and Cami Young. Please join Dr. Ruth Westra next week for a program on cholesterol problems, when our panelists will be Dr. Kimberly Bodecker, Dr. Adi Lakari, and Dr. Jake Powell. Thank you very much for watching, and good night.